Hello everyone, welcome to scardia.com. My name is Saima Mushtaq and our today's topic of infectious medicine is encephalitis. This topic we will discuss in 4 sections. In the first section, we will talk about the definition of the encephalitis. What is encephalitis? How it presents clinical manifestations of encephalitis. And also we will talk about different causes that can cause encephalitis. Then in the second section, we will talk about the antiviral therapy for the treatment of encephalitis. What are the different antiviral drugs that can be tried against the viral encephalitis? In this, we will also talk about the complications of those antiviral drugs that can be tried against the viral encephalitis, and also we will discuss the cidofovir and intravenous ribavirin therapy. Then in the third section, we will talk about the conditions that comes under the chronic encephalitis, and these are the progressive multifocal leukoencephalopathy, which is PML, progressive multifocal leukoencephalopathy. Clinical features and pathology of PML, and also what are the tests done, what are these different serological studies, and the treatments available for the chronic encephalitis. Then in the fourth and final section, we will talk about 2 other conditions, which are sclerosing panencephalitis and also progressive rubella panencephalitis, and again how we can diagnose these 2 conditions and how we can treat these 2 conditions. So all that we will discuss in our today's lecture topic, which is encephalitis. Keep watching scardia.com.